Good day, everyone. I'll be presenting on a topic I titled Regression Analysis of Non-Retention Among Adolescents and Young Adults Receiving Antiretroviral Therapy in Kogi State, Nigeria. This is a poster presentation presented at BigSurv20. My name is Moses Luke. Why are we looking at retention among adolescents and young adults? Before I go to that, retention in care of HIV infected person or patients on ART is of a growing public health concern. It has becoming a kind of a public health challenge because day in, day out, we keep losing our clients and we want to know the reason. But most importantly, we are looking at adolescents and young adults because they have increasingly become vulnerable to HIV infection, according to WHO 2013. So retention in care is extremely imperative, not only to reduce individuals' HIV-related mortality and morbidity, but also to minimize or a means to deliver positive preventive intervention towards reducing HIV transmission. If we are able to keep and properly manage those on ART, there won't be any reinfection or transmission anymore. The method used in this research work is a cross-sectional study design, and we use a multi-stage sampling technique to select 307 respondents. All these people we are living with HIV, they are actively or lost, let me put it that way, or lost to follow up. But they have one time or another used ARV. So the target population, our focus is we are focused on adolescents and young adults between the ages of 10 and 24 years. Between the age of 10 to 24 years, and they are on ART in this study location. So our result shows that the predominant age group of patients living with HIV who were receiving ARV in the study location were between the ages of 15 and 19, and they accounted for 52.1%, followed by the young adults 20 years to 24 years accounted for 35.2%, while the least group, which is between the ages of 10 to 14 years, they accounted for 12%. The majority of adolescents and young adults, which accounted for over 80%, who participated in this study, had spent close to 5 years on ARVs. Within this age group, they have been on ART for more than 5 years or close to 5 years. The proportion of adolescents and young adults who could not say if they have received treatment with dignity and respect from their healthcare provider is worrisome, because this accounted for about 42.3%. What we are trying to look at is this: what is that thing that makes you not, to be retained in care? So during our interview with those respondents, they open up and reveal a lot of things to us, which this is one of them. Why those who claimed that they have never gained respect from healthcare provider accounted for 30%. Also, the binary logistic regression shows that there was a significant association between lack of interest developed by the patients on ART and their retention in care. It is 0.03 times chance of them losing interest in picking up their ARVs or leaving the facility totally. There was also significant association between stigmatization and patient's retention. So we have two things that we are looking at here now. Patient does not have interest, and another thing is stigma. So those areas need to be looked upon very well, very critically. So in conclusion, a major challenge to HIV treatment success is stigmatization, which has continued to discourage patients from accessing quality and optimal care. Low retention rate results from weak supports system or scarcity of resources for programs. Other associated structural factors include transportation, poverty, and discrimination. So this area we need to critically look at those areas and address those factors that contribute to retention in Kogi State. Therefore, there is a need to address the underlying factors of non-retention in care of patients on arts program, taking into account that every single patient who is retained in care of and on antiretroviral therapy is a life saved and potentially a source of tremendous benefit to the family, community, and the nation at large. Thank you for your time.